we're going to go ahead and get started with the subcommittee. So once we have a quorum, I'll interrupt if there's any witness testimony going on at that time, so we can take roll. I'll go ahead and go through some things here. When a witness is about to speak, he or she should introduce themselves and address their comments to the committee. Witnesses need to keep their comments relevant to the bill being heard. Each witness must complete a witness appearance form and leave it on the desk. Only individuals or organizations testifying in person will be recorded in the committee minutes. Members of the committee, remember to speak into your microphone so those listening online can hear what the committee is discussing. After the sponsor presents a bill, we will proceed first with those testifying in support, followed by those in opposition. For committee scheduled purposes, I may have to limit those times testifying. We're going to do Senate Bill 481 last. I know there's probably quite a bit of testimony here on that. So with that, we're going to go ahead and get started with Senate Bill 635. Senator Gregory from the 21st, if you're here, whenever you're ready.
Thank you, Mr. Chair. It's a pleasure to have you back stateside after your absence. I'm sure it treated you well. It sounded like you were in a great place.
Can't imagine I'd rather be anywhere but right here listening to you testify.
Absolutely. Absolutely. For the record, State Senator Curtis Gregory, Senate District 21, before you today. Senate Bill 635 modifies the Health Professional Student Loan Repayment Program. There is a substitute. I do believe it's been put in front of your all's chairs up there. So it was my understanding, and I'm sure someone can testify behind me, that there is money going unused that I think comes from the federal government, because we were only using this program just for doctors and dentists, and this will open it up or allow us to pull down greater federal dollars up to $575,000 to cover other areas of needs like nurse practitioners, certified nurse midwife, physician assistants, registered dental hygienist, psychologist, licensed clinical social worker, psychiatric nurse, licensed professional counselor, marital and family therapist, registered nurse, and pharmacist. There has been, the main change in substitute was working together. Wanted to make sure that we protected the doctors the most. So if you see the front page of the summary, I think at least 35% of the funds appropriated each year shall be designated for awards to primary care physicians and general dentists. So that's how the substitute differs from the as-filed version. If you have to take any questions.
Thanks, Senator. Any questions from the committee for Senator Gregory? All right, seeing none, the first witness to testify in favor of the bill, whenever you're ready, please come forward. Can I get a show of hands of how many witnesses there are testifying in favor of the bill, please? How many in opposition? Is there any informational purposes only? All right, thank you. Whenever you're ready.
Hello, my name is Ben Terrell. I'm the Legislative Liaison for the Department of Health and Senior Services. I want to thank Senator Gregory for carrying this bill, and I want to thank the committee for taking the time to hear it. Currently, the Missouri Department of Health and Senior Services oversees the Health Professional Student Loan Repayment Program. This program is limited to medical doctors, doctors of osteopathic medicine, and dentists, and provides loan assistance in exchange for working in an area where there's a shortage of relevant providers. This is a program that pulls down federal dollars, but because we are limited in statute to who it applies to, we're limited in the amount we can count as a state match to then pull down federal dollars. So this bill essentially mirrors what the federal program allows so that we can count existing programs as the state match and thus pull down up to $575,000 extra dollars. As a note, when we'd first done this, the doctors had some concerns that they could potentially lose money under this bill. So as Senator Gregory mentioned, we've added language at their request to reserve 35% of the funding for doctors. But if they don't use that full amount, it then rolls over to those other professions, because we want to make sure that if we've got something, we want to use it. We want to make sure that we're putting people where they need to be. So we're pretty excited about this. We think this is going to be some really good workforce recruitment. And I'm happy to take any questions. The Nursing Association also asked me to submit their form because they're here taking the call.
Thank you for your testimony. Are there any questions for the witness from the committee? All right, seeing none, next witness testify in favor of the bill whenever you're ready.
Mr. Chairman, members of the committee, Jacob Scott with the Missouri State Medical Association and the Missouri Association of Osteopathic Physicians and Surgeons. Wanted to go on record in support of the bill. Very much appreciative of the sponsor and every stakeholder that's worked on this legislation. When we talk about creating rural access and creating more opportunities for physicians to live, work, and practice in our state, this is a great bill that helps achieve that goal of ultimately providing the best care possible to your patients. And we thank the committee for their support, and I'm happy to answer any questions.
Thank you. Any questions for this witness? Seeing none, the next witness testify in favor of. Whenever you're ready, please come forward.
Good morning, Katie Gamble here on behalf of the Missouri Academy of Physician Assistants. Want to go on record in support of the legislation. We're thankful for the addition of our providers within the legislation.
Thank you for your testimony. Are there any questions for this witness? Seeing none, next witness testify in favor of the bill. Whenever you're ready.
Morning, Mr. Chairman, morning, members of the committee. My name is Cade Tremaine. I'm here today on behalf of the Missouri Chamber of Commerce and Industry to testify in support of the bill. Each year, the Missouri Chamber releases a CEO survey to Missouri business leaders, essentially just trying to gauge the major issues that are hitting them and the business climate that they find themselves in. One of the questions that we ask them are, when considering retaining your workforce and attracting new talent, which quality of life factor has the biggest impact? And among 6 categories, access to healthcare was the second largest concern that they brought forward. So ultimately, Missouri healthcare professionals will see that we are investing in their field. Those who may be locating or relocating to Missouri will understand that we care about their physical and mental well-being. And so overall, we support the bill. Is there any questions from the committee?
Thank you for your testimony. Are there any questions for this witness? Seeing none, are there any other witnesses to testify in favor of this bill? Whenever you're ready, please come forward.
Thank you, Mr. Chair and members of the committee, for allowing me to testify today, and thank you to Mr. Senator Gregory for carrying this bill. My name is Ben Pillsbury. I'm a freshman studying for a degree in nuclear engineering at Missouri S&T in Rolla, and I am a legislative advocate for the Associated Students of the University of Missouri, ASUM, which is a nonpartisan student organization focused on civic engagement for the benefit of its 61,000 students in the UM system across our 4 campuses. I'm here today to express our support for Senate Bill 635 on behalf of our students. I'll happily take any questions.
Thank you for your testimony. Are there any questions for this witness? Seeing none, are there any other witnesses testify in favor of this bill? Are there any witnesses testify in opposition to this bill? Oh, we got one more in favor of. I'll remind you to leave witness statements, so if you want your testimony to be in public record, we have to have those.
Thank you, Mr. Chairman, members of the committee. David Jackson going on record in support on behalf of Jefferson City Medical Group.
Thank you for your testimony. Are there any questions for this witness? Any other witnesses testify in favor of the bill? Opposition? For informational purposes only. Well, look at you, Mr. Popular. Nobody is going to testify against your bill. I bet you Senator Bernsker wished he could say the same thing in about 10 minutes.
I told him I was going to get this over with because I know we're both in Commerce Committee. So thank you, committee, for hearing this. I hope we can get across the finish line. Get it added somewhere. Thank you.
All right, thank you. Next up, we're going to hear Senate Bill 219. Senator Black, if you're here, whenever you're ready, we're ready for you.
Oh, this room and my fat body. Good morning, Mr. Chair, members of the committee. For the record, my name is Rusty Black. I represent the 12th Senate District, representing 19 counties and over 10,000 square miles, which is larger than the states of Maryland, Vermont, New Hampshire, Massachusetts, New Jersey, Hawaii, Connecticut, Delaware, and Rhode Island. This bill, I think, is a discussion about access, right? Diabetic, last time I seen my doctor was either 21 or 22. I appreciate the opportunity to present Senate Bill 219, which is aimed at modernizing the scope of practice for optometrists in the state of Missouri. This bill seeks to refine and expand the legal framework governing optometric care. Currently, the practice optometry does not include the provision of surgical procedures, including the use of lasers. It does not include the use of injectable agents. Senate Bill 219 allows for the use of injectable agents for the purpose of treatment of the eye and some word I can't pronounce, and shall include surgical procedures except as otherwise specified and limited by the Board of Optometry. And with that, the experts about this, both pro and con, are behind me, right? And looking at the four people sitting up there officially, we know you probably don't want me operating on anything, but I'm more than willing to try. Okay? With that, is there any questions?
Thank you, Senator, for your testimony. Before we take questions from the committee, can I get a show of hands of how many people are here to testify in favor of the bill? Opposition? Okay. All right. Are there any questions? Senator, whenever you're ready.
Can you attempt to pronounce the word that you couldn't pronounce?
I know you're trying to be.
It's okay,
Nurse
Senator.
anexa? Is that some part of a body?
Yeah.
Is it? Can
You're
I get to it from the outside, or do I have to get inside to touch it?
I'm not doing surgery on eyeballs,
Okay.
so I don't.
Yeah, I want to know whether I need a palpation glove or not.
What could go wrong? Are there any other questions for this witness or the senator? All right, first witness to testify in favor of, we'll go ahead and do the in favor of first and the opposition last. So the first witness to testify in favor of the bill whenever you're ready.
Thank you so much, Senator Black. Good morning, Chairman Brown and members of the committee. Thank you so much for allowing me to testify today. My name is Dr. Kelly Deering, and I've been practicing optometry in Chillicothe, Missouri for the last 5 years. My practices up north serve 15 counties in north central Missouri. I fully support SB219 because modernizing optometry's scope of practice would immediately improve access to eye care for each of your constituents, especially my elderly and rural patients, while ensuring the ability of Missouri to attract and retain the best and brightest optometrists. Simply put, SB 219 will allow Missouri optometrists to perform in-office surgical and laser procedures that we are already very well educated, trained, and certified to do. Optometrists across the nation have been safely and effectively performing these procedures enabled by SB 219 since the 1990s, with more than 146,000 procedures to date in our country. Last year, this bill passed the Senate's Governmental Accountability Committee and the House Professional Registration Committee. We're here again this year to get it to the finish line. This year, we also addressed prior concerns by adding a provision which explicitly defines that all future optometric procedures be regulated by our Missouri State Board of Optometry to ensure that our education and scope is under constant review. There are many overlaps between optometry and ophthalmology in training and practice, and it can be really confusing. But the main differentiator is that ophthalmology provides in the eye intraocular surgeries, which this bill acknowledges and seeks to preserve. Optometrists like myself, we serve a role more akin to your general family practitioner, but for the eye. We specialize in correcting vision and identifying and treating eye disease. Optometrists are trained and capable of doing standard in-office surgical procedures. Think your physician removing a wart, but we refer to specialists when surgical subspecialty is needed, like a cardiologist doing heart surgery. And ophthalmologists are intraocular surgeons. They rely on our expertise already to diagnose the problems that they surgically treat and to manage patients' postoperative care of the surgeries that they perform. For these procedures, our training is a little different, but our outcomes are the same. This is evidenced by the fact that nationwide, Medicare and the Veterans Administration pay optometrists and ophthalmologists the same for these in-office procedures. Optometry in America is legislated by individual states and regulated by state boards of optometry, which define scope using a combination of inclusionary language, optometrists can do this, and exclusionary language, optometrists cannot do this. And Missouri law currently uses inclusionary language, And the last time it was updated was in 1995 when I was 1 year old. Under the law, I cannot legally give an EpiPen, but it can be self-administered by patients. So our Missouri statute is just woefully outdated. In 2025, there are 42 states that allow optometrists to perform injections, including every state that borders Missouri outside of Kansas, but their very similar sounding bill is already through the House committee. 20 states allow optometrists to remove eyelid bumps, including 5 border states. And then there are 12 states that allow optometrist laser procedures for glaucoma and post-cataract film, including our neighboring states of Arkansas, Oklahoma, and Kentucky. Eye care progresses quickly, and honestly, just Missouri's fallen behind. The exclusionary language behind SB219 ensures that Missouri remains competitive with its state peers. And of the 12 states with modernized optometry statutes, 9 of them use exclusionary language detailing what optometrists cannot do. And this language, honestly, in my opinion, offers the clearest dividing line between optometric surgery and ophthalmic surgery. And that protects patients, it protects our professions, and it keeps Missouri eye care top-notch. So in conclusion, today you're going to hear from optometrists, a professor, an optometry student, and a very well-loved patient of mine who can speak to our education, eye care's future, what it's like to be able to cross the state border to perform these procedures, and the crisis that is Missourians' access to eye care. This last point is very personal to me because my patients are currently having to wait 3 months for procedures that I'm trained to do. And this means that they're driving at night with impaired vision, reduced depth perception for months when I have the training to help them today. I spent 10,000 hours in optometry school. I saw 2,000 patients before graduating, and I've cared for 30,000 patients since then. I became an eye doctor so I can take care of every eye need that my patients have year after year with my training. And so that's my ask to you today, to expand optometry scope to perform, for me to be able to perform procedures that I'm already very well educated, trained, and certified to do. So thank you so much for your time. I'll take any questions that you have. Thank you.
Thank you for your testimony. I have a question, and I mean, please don't think I'm attacking you when I'm asking you questions.
No, you're good.
Part of this committee, that we deal with professional licensing. We get a ton of these bills, or a vast majority of these bills, where not just your area, but a lot of different professional licensed people that want to expand the scope of whatever they're doing. But my first question is the prerequisite to get into like an ophthalmology school the same as to get into medical school?
It's very similar, yes.
So it's not the same?
Actually, I think most of our prerequisites align really well. So
well, but that's not my question. My question is it the same? I mean, like, I would be curious to see what the curriculum is to get into, optometry school versus like medical school.
Yeah.
And my second question that is, why don't you just go to medical school and become an ophthalmologist?
Because most optometrists want to see their patients every year and develop that relationship and take care of all of their local eye care needs. Essentially, the surgical procedures that this bill would allow, 100% of optometrist surgeries are these procedures, but it's only 8.5% of what ophthalmologists do. So ophthalmologists do specialty surgery, and that's all they do. They're not seeing patients every single year.
Well, I'm come from a pretty rural town, and I see an MD ophthalmologist for my regular eye doctor. After my optometrist that I had, I started wearing glasses when I was in the 3rd grade.
Yeah.
I had retired, and that's all he does is he doesn't do any surgeries. It's all basically eye exams. Now, if you have something going on, I'm from personal experience. I nearly lost my left eye about 10 years ago in a minor accident, and I assure you, if it wasn't for him, I think I would not have the sight in that eye today.
Yeah.
But he sees patients regularly, just like matter of fact, we have probably in my hometown more MD ophthalmologists that we have optometrists through like Mercy in our local Phelps Health Hospital. But
And there sometimes will be clinics where you have general ophthalmologists, but then they generally also have specialists in their practice performing like specialty surgeries, like cataract, glaucoma, or retinal surgeries.
All right, thank you. Are there any other questions for this witness? All right, seeing none, are there any other witnesses to
Thank
testify in favor of the bill?
Thanks, Rusty.
Whenever you're ready, please come forward.
I submitted it online. Is that going to work? Okay.
Thank you so much, Senator Black. We're really thankful for you to be here to support our bill. My name is Dr. Angel Novel Simmons. I'm a practicing Missouri optometrist. Thank you also to the committee. Thank you, Senator Brown. I've been practicing in Missouri for over 20 years. I graduated from UMSL's College of Optometry in 2003. UMSL's the only optometry school in our state. Not only do I attend to the needs of our patients in Missouri, but I also educate at our state school. I'm an associate clinical professor, and I'm also the associate dean of student services and alumni relations, and I'm the director of continuing education. I'm going to kind of speak to you from a couple of different lenses, just so you can kind of understand what we do and how we work at the school. From the lens of the Associate Dean of Student Services, all schools are accredited. We have a body that accreditates our practice. They evaluate and adjust the curricular demands based on patient needs across the country. If you attend one school of optometry, that means that you can practice optometry in any of the states. We all have to follow the same educational guidelines. I'm often asked when I interview students who are potentially thinking about UMSL as their choice of college, their optometric program, what makes Missouri such a great place to practice? What makes UMSL stand out above the rest? We're a small school. We have very intentional, detailed, comprehensive education, and we also make sure that our students are educated to the highest scope of practice. Now, while in Missouri they can't practice to that highest scope, I still educate them to the highest scope because they have to be able to leave Missouri and still be able to practice anywhere. In order to do that, it's just kind of one of those things that we want that experience to look great across the board. Oftentimes, we think there's a shortage of ophthalmologists, but if we cannot allow these students, when they graduate, to practice at that highest scope, we're nervous that we're not going to have optometrists to even serve in this state. And so we want to make sure that we're allowing those students to do that. As Dr. Deering mentioned, we have over 10,000 hours of training. Our first year curriculum includes a deep dive into the anatomy and physiology of the eye, the body, neurology, optics, optometric care. We have to understand the entire body in order to treat the eyes. They're not two separate entities. Eyes don't float around in the world by themselves. The body doesn't. We're all kind of connected. So we have to understand everything. And that's what our curriculum does. It increases in its complexity when you get to your second and third year. And then fourth year is all clinical training. So you asked the question, what made me decide to go to optometry versus ophthalmology? My degree is in biology. I was set up to go to med school. I chose not to. I wanted to do something different, and I wanted to serve in a different capacity. So our prerequisites are the exact same to get into optometry school as to getting into med school. We're a 4-year program that's post undergrad. So a degree in biology, that's me with a minor in chemistry. It's the same. And most med students, when they're going into med schools, have that same prerequisite load. We've been doing this over 20 years at our school. We have a course that trains our students in these applications that we're asking for in Senate Bill 219. We navigate the patients preoperatively and postoperatively, so our students are well versed in how to navigate that. During our clinical training, we have to use eye models in order for our students to get the training that they can't do live because we don't have the scope of practice here, but that's very similar to ophthalmology. That's very similar to other surgical components, right? I mean, they'll use a pad and they learn how to stitch on that. They don't just cut a person open and learn how to stitch that way. 90% of our clinical faculty have all been recertified in the advanced lasers procedures and minor surgical procedures. So 90% of our faculty is up to date and we are ready to go. so we can continue to educate our students. And lastly, I just want to say that we just doing a weekend course does not bypass the 4 years of comprehensive education that we put forth. So, I mean, I am well versed in what to do. If someone has a lid lesion that looks really crazy, I'm going to send them to the specialist that can navigate that. I'm not going to do cataract surgery because that's not in my purview. But can I treat someone for glaucoma? Absolutely. And as the Director of Continuing Education for UMSL, I make sure that Missouri ODs and state and local ODs and regional ODs are up to date on all of the training that they need. And so we bring in speakers from other states, other areas to provide us with the education and the continued education so that we can be the best optometrists and we can keep up with the advancement in our profession. And with that, I'll take any questions.
Well, thank you for your testimony, and you did do a good job answering my question, so I'm going to ask you this. So did you know what the scope of practice what the scope of practice was compared to what you're doing now to an ophthalmologist when you chose not to go to medical school and to go to ophthalmology school? Did you know the difference in the scope of practice?
Absolutely.
So why would you want to change it now? You could have went to medical school, it sounds like, if it's the same thing. Mm-hmm. So my question is on all these, not just this profession, but nurses and everything else. And, you know, I'm a firm believer in sticking to your scope of practice. That's why we have scopes of practice. Mm-hmm. And my second question is, since you're involved with the university, what is the starting pay for a ophthalmologist versus a optometrist coming out of school?
Okay, so to answer
well, it doesn't have to be an exact number, but maybe I should rephrase that. The difference between like a physician versus
OD versus MD. As an optometrist, I think our average pay right now or starting is about $160,000, if I'm not mistaken, $160,000.
And I won't hold you to the number. I'm just trying
yeah,
to.
Please don't. And then I think with ophthalmology, I'm assuming it's probably about $100,000 more than us. I'm
Okay.
just saying, I don't know their pay.
So
if I'm
part B
being
of that
honest.
question is, when these hospitals that are mostly corporations now start hiring these people, how many MD ophthalmologists are going to lose their jobs if we pass this bill?
None. They still have a whole breadth of things that they are doing that we don't do.
So you think that if they can hire 2 optometrists versus 1 ophthalmologist, that's not going to be something that they look at on their bottom line?
But optometrists in this bill, we're not asking for things that we are outside of our purview. So if that they would have to still have
Well,
an
I mean,
ophthalmologist
it sounds like it is because you're wanting to do things you can't do now.
True, but we already do those in other states. And that is, and
Well,
we're
but this is
providing
Missouri,
that.
you know. So anyway,
So, I mean, I just, if I can, an ophthalmologist is going to do, like, they'll do retinal surgeries, cataract surgeries, injectables, like for retina stuff, fixing retinas. Optometry, we can't do that. That's not in our purview. So you would still have to have an ophthalmologist that's on staff there in addition to optometry in order to navigate all of those advanced surgical procedures that we're not trained or certified or licensed in. But the ones we're asking for in Senate Bill 219, we are trained, we're certified, and we're educated in those all day, every day. And we've been doing that.
I would be curious to, is there anybody here from the Board of Appealing Arts? I would be curious to get their opinion on that as well. And but anyway, thank you for your testimony.
Absolutely. Thank you.
Is there any other questions for this witness? All right. Next witness to testify in favor of the bill whenever you're ready. Before you get started, now that we have a quorum, we're going to go ahead and take roll. The Senate Committee on Emerging Issues, Professional Registration is being called to order. Ashley, call the roll.
Chairman Brown,
Here.
Senator Berger, here. Senator Brown, here. Senator Huff, Senator Lewis, here. Senator McCreary, Senator Shore. Here.
We have a quorum. Proceed whenever you're ready.
Thank you, Chairman and Senator Black and the rest of the committee members for your time today. My name is Emerald Jones. I am a third-year student at the University of Missouri. Oh, sorry. Okay. I am a third-year student at the University of Missouri St. Louis College of Optometry. I am also the president of our Missouri Optometric Student Association and student liaison to the Missouri Optometric Association Board. As a third-year student, I'm about to start my fourth year in May. This fourth year is when we do our clinical externships and are in clinic all day, every day. That being said, we have 1 year left, and my classmates and I are starting to begin to look at where we want to practice in the future. One of the key factors that plays into the decision is the scope of practice in the states we are considering to practice in. For us, this is important because over the last 3 years, we have spent countless hours learning and honing our skills to provide patients with the best care possible. I personally have chosen to do one of my externships in Oklahoma this summer because when I'm there, I will be able to train and perform these procedures with supervision, of course, on patients. To further show the importance of scope of practice to our students, we polled some of our students. So out of 175 students, 75% say scope of practice is influential when deciding where to practice in the future. Only 35% of our students plan to stay in Missouri. And when Missouri residents were polled, 70% said they would consider leaving the state if scope of practice does not change. In addition, 44% of non-residents said they would consider staying in Missouri to practice if our scope of practice does change. In comparison to our neighbors in Oklahoma, where they also have a school, 50% of their students are from out of state, and 75% of their students choose to stay in Oklahoma because they have that expanded scope of practice. So a big difference from the 35% of students saying they want to practice in Missouri. So in conclusion, scope of practice must change to ensure that Missourians continue to have access to primary eye care providers in the future. Students and new graduates want to go where they are respected and are able to provide the highest level of care possible to patients that we are trained to do. Thank you for your time. I'm happy to answer any questions.
Thank you for your testimony. Any questions for this witness? All right, seeing none, before we go to the next witness, we're going to go ahead and move into an executive session because we have some members that need to get to other committees. So I make a motion to move into executive session. Do I have a second? Second. I have a second. We're in executive session. I move that Senate Bill 283 be brought before the committee. Do I have a second? Second. I have a second. All those in favor say aye. Opposed, no. The ayes have it. The bill is before the committee. I move the Senate Bill 283 be voted out of committee. Do pass. Do I have a second? Second. I have a second. This is Senator Ben Brown's bill. He presented this, Senate Bill 283. It allows license reciprocity waivers for spouses of Missouri law enforcement officers. Is there any discussion? Ashley, call the roll to vote Senate Bill 283 out of committee. Do pass.
Chairman Brown.
Aye.
Senator Berger.
Aye.
Senator Brown.
Aye.
Senator Huff. Senator Lewis.
Aye.
Senator McCurry. Senator Shore. 4 days.
What is it? By your vote of 4-0, the motion carries. Next, I now move that Senate Bill 327 be brought before the committee. Do I have a second? Second. I have a second. All those in favor say aye. Opposed, no. The ayes have it. The bill is before the committee. I move that Senate Bill 327 be voted out of committee. Do pass. Do I have a second? Second. I have a second. This is, again, Senator Ben Brown's bill, Senate Bill 327. This is the dental and dental hygienist compact bill. Is there any discussion? Seeing or hearing none, Ashley, call the roll to vote Senate Bill 327 out of committee. Do pass.
Chairman Brown.
Aye.
Senator Berger.
Aye.
Senator Brown.
Aye.
Senator Huff. Senator Lewis.
Aye.
Senator McCurry. Senator Shore. 4-0.
By your vote of 4-0, the motion carries. I now move that Senate Bill 513 be brought before the committee. Do I have a second? Second. I have a second. All those in favor say aye. Aye. Opposed, no. The ayes have it. The bill is before the committee. I move that Senate Bill 513 be voted out of committee. Do pass. Do I have a second? Second. I have a second. I presented Senate Bill 513. This will be the best bill we vote on today. This allows the operator of the self-service storage facility may enforce a lien by selling the personal property by advertising the sale in the classified section of the newspaper or in any other commercially reasonable manner. Is there any discussion on that? Hearing none, Ashley, call the roll to vote Senate Bill 513 out of committee. To pass.
Chairman Brown.
Aye.
Senator Berger.
Aye.
Senator Brown.
Aye.
Senator Huff. Senator Lewis. No. Senator McCurry. Senator Shore. 3-1.
By your vote of 3-1, the motion carries. I now move that Senate Bill 455 be brought before the committee. Do I have a second? Second. I have a second. All those in favor say aye. Aye. Opposed, no. The ayes have the bills before the committee. I move that Senate Bill 455 be voted out of committee. Do pass. Do I have a second? Second. I have a second. This is the prestigious Senator Huff's bill, Senate Bill 455. Timing? Yeah, I was going to say great timing. Glad that you could join us. This bill authorized the child tax care credit. Is there any discussion? Hearing none, I should call the roll to vote Senate Bill 455 out of committee. Do pass.
Chairman Brown.
Aye.
Senator Berger.
Aye.
Senator Brown.
No.
Senator Huff.
Aye.
Senator Lewis. Senator McCurry. Senator Shore. 4-1.
By your vote of 4-1, the motion carries. I now make a motion to move out of executive session and resume our regular hearing. We have a second. We are back in a regular hearing. Next, witness testify in favor of the bill. Whenever you're ready, please come forward. How many other witnesses do we have testify in favor of? Raise your hands. 2? Okay. We're doing great. Let's keep it up.
Chairman, members of the committee, Senator Black, thank you for allowing me to be here to testify today. My name is Mark Severing, and I am not a doctor. I'm a pastor and a retired school superintendent, but I'm not here today in either of those capacities. I'm here as an eye patient, and I'm here as a son. In August of 2021, my wife and I were living in Nebraska, where I had recently retired as a school superintendent. I was on a phone call with my mom one day, and she explained to me that my dad had a dermatology appointment in Kirksville. Kirksville, Missouri is about 90 miles from my mom and dad's home in rural Mooresville. And my mom explained to me that my dad could drive to his appointment, but then she would have to drive him home. And when I heard that statement, I said, now what's wrong with this picture? My then 95-year-old dad was about to drive 90 miles to a doctor's appointment, and my nearly 90-year-old mom at the time was going to drive him home. And I turned to my wife and I said, I think it's time that we move back. We are extremely fortunate my wife and I, to be in our 60s, and we have my parents are still with us. My in-laws are still with us. So at the end of 2021, we packed up and we moved back to Missouri. Now live about 10 miles from my parents. Since moving back, we have logged several hundred, maybe into the thousands of miles to drive mom and dad to and from medical appointments. My dad's a 98-year-old World War II Navy veteran. He no longer drives, which is a good situation. Mom turned 93 yesterday, and she drives very minimally. So we've made several trips for appointments. Many of those have had to be outside of our area. And as time goes on, those trips that are outside our area are becoming increasingly difficult. Now, I recognize that I'm fortunate to be in a position that I have the flexibility that I can help mom and dad in this way, but I recognize that a lot of elderly people don't have that support. They may not have a friend or a family member. So since returning to Missouri, my wife and I both, and also now our parents, have seen Dr. Kelly Deering for eye care. She's been a fantastic choice for all of us. We have complete trust in her abilities as an optometrist, and we would certainly welcome the opportunity if we needed any of these procedures done that she is trained to do. We would welcome the opportunity to have her do those rather than have to travel outside of our area, especially with my 98-year-old dad, to get a procedure done by someone that we don't know. I think this is especially important the older that my folks get. Older people such as my mom and dad, especially in rural areas such as where my mom and dad live, should be able to access care from optometrists such as Dr. Deering or any other optometrist that they know and trust, that are educated and trained to do these procedures. I respectfully request that serious consideration be given to passage of Senate Bill 219. I'd be happy to answer any non-technical questions.
Thank you for your testimony, and please tell your father thank you for his service.
Thank you.
Are there any questions for this witness? Hearing none, is there any other witnesses testifying in favor of the bill whenever you're ready?
Thank you, Chairman Brown and members of the committee. My name is Julie Hart, and I am an optometrist in West Plains, Missouri. I do have my Arkansas license. I am allowed to do these procedures we're asking for in our bill in Arkansas. so I can drive 20 minutes down the road, perform a YAG or take a skin lesion off. So I've considered opening an optometry office just down the street or down the road, 20 miles, just so I can get my patients care they need in a timely fashion. I never had any interest in getting my Arkansas license until they passed their scope bill 3 or 4 years ago. Since obtaining my Arkansas license, my malpractice rates have not increased. Our malpractice rates have not increased. Let's see here. My patients ask me frequently, can we just drive across the border and go get these procedures done? And I joke with them. I said, I'm going to rent a van and we'll go down to the Mammoth Spring parking lot at the state park and, do these procedures. I'm not, but, I will get an office down there and do these things. I do have a letter from Dr. Osborne. He's a practicing ophthalmologist in Springfield, and he does support us in these procedures. He is willing to let us, come to his office and perform a YAG or an SLT. I think it's pretty awesome that he would let us do that as an optometrist. Any questions?
Well, thank you for being here, and thank you for your testimony. Do you have, I'm somewhat familiar with West Plains. I'm assuming there's some MD ophthalmologists at the hospital there.
There's one ophthalmologist in town. There's a second one coming.
Okay. So just curious why, if they have that service there in West Plains, why would your patients want to drive 20 miles across the border? Is there a price difference in it?
No price difference.
So it costs the exact same money to see a optometrist versus an MD ophthalmologist?
If he
20 miles across the border.
If he does it in his surgery center, there is a facility fee added on to the patient's cost, so
Okay.
that may change their copay.
So I'm trying to get my head wrapped around what we're wanting to do here. So you could do their procedures in your office.
Yes.
So again, this all boils down to what can we do the same procedures for less money, the way I look at it.
We are.
And I'm not sure that's in the best interest of the patient.
Right.
Because
So,
I'm all about, with healthcare, about patient care
right.
versus the bottom line. And you may not know this, and don't worry about it if you don't, but how does Arkansas rank, like, healthcare wise versus like Missouri?
I'm not sure for
Okay.
optometry or ophthalmology.
Okay, and we can find that out. But anyway, thank you for being here. I know this can be intimidating sometimes, and please don't feel like that. But are there any other questions for this witness? Senator Lewis.
Hi there.
Hi.
Thanks for testifying. So I've heard this bill a couple of times, and y'all had like a reception with the little lasers
Yeah.
and stuff.
Yeah.
So that's always fun. I think something that I haven't heard, isn't there like a wait time? If one of the benefits of going to you all
Yeah.
is that to get the issues addressed in a more expedited process
Yes.
versus several. So do you want to speak to
Yeah.
that a little bit?
So if I have a patient who needs a YAG, for example, we have to refer them to the surgeon. At the moment, it's usually a month or more to get an appointment with the surgeon. They do the evaluation, and then they may or may not bring them. I don't think they do the YAG the same day that they see them. They'll bring them back and perform the YAG later. Some may do it the same day, some may not. I'm not sure how they do that. But if they were to come to my office, I could identify that there was a problem, that they need the YAG, and then either perform the procedure the same day or bring them back in a couple days.
Okay. All right. Thank you.
Thank you for your testimony. Are there any witnesses testifying in favor of this bill? Whenever you're ready, please come forward. Are there, and I bet, any witnesses testifying in opposition to this bill? Whenever you're ready, please come forward.
Good morning. Thank you, Mr. Chairman, and the members of the committee for allowing me to speak today. My name is Zachary Doctor, and I'm here on behalf of the residents at the University of Missouri, Kansas City. I'm an ophthalmology resident there in that program, and I'm currently in my third year of training, and I'm here today in opposition of Senate Bill 219. To provide eye care to a patient is a privilege that should not be taken lightly. As physicians, we took an oath to our patients to do no harm and to put them first. And Senate Bill 219 has a strong potential to put Missouri's patient safety at risk, especially when it comes to their vision. First, I think to understand these risks, it's important to understand the training differences between optometry and ophthalmology, and I know this is a point that's been reiterated to you guys probably ad nauseum, but I think it's an important distinction to understand. Ophthalmologists undergo 4 years of college, followed by 4 years of rigorous training in medical school, followed by another 4 years of rigorous surgical training in residency, and some even go on to do another year or two in fellowship. It is during these years that ophthalmologists are not only taught the technical proficiencies of eye surgery or acquire the in-depth medical knowledge of eye pathology and diagnostic skills, but we are also extensively trained to assess the patient's suitability for surgery and how to manage and identify complications in order to provide the best comprehensive operative and postoperative care. Optometry, on the other hand, they do 4 years of undergraduate training, followed by 4 years of optometry school training, which is a different beast in itself, but it's not the same rigorous training that we have in our medical school and our residency training. And it's their education lacks the surgical depth that is required to ensure patient safety and the procedures that we perform on a daily basis. The proposed changes in the current bill look to expand the scope or practice of optometrists to include the use of lasers, as well as the removal of lumps and bumps around the skin. As a current resident, I can attest that these procedures are nothing short of benign. While these procedures are very commonly performed in our offices every day, there are serious potential complications that can arise, such as high pressures within the eye, inflammation inside the eye, retinal holes or retinal tears, and even retinal detachments, and direct damage to the intraocular lens in the eye following the routine laser surgery. Additional lumps and bumps on the skin could very well be cancerous lesions that could be overlooked by the untrained eye, potentially leading to misdiagnosis and even severe harm or even possible death. As mentioned before, we residents, we go through rigorous training in order to help identify and minimize these complications and or potential misses to reduce patient harm. And I think to allow an individual who's not been trained in that capacity to perform these procedures creates an uncalled for risk that is just unacceptable. At the end of the day, I think the thing that you guys need to consider is if it was your eye or if it was your family member's eye, who would you want taking care of you and doing these procedures? Would you want the highly trained surgeon who has gone through rigorous surgical training and who has learned the ins and outs of the procedures and how to anticipate or manage the complications that could occur? Or would you want the individual who does not have that background and potentially just learned how to perform the procedure in a weekend course? With all that said, and coming from an optometrist son and myself, I do believe that optometrists play a vital role within eye care and are prominent members in the patient's eye health. They oftentimes are the primary care provider for patients' eyes and help initially identify eye problems and can even help initiate appropriate medical treatment, which is well within their scope of practice. However, I believe that this should be limited to the non-surgical and non-procedural eye care of these aspects of care just not covered in their level of training. In the end, it's really about patient safety that matters the most. Thank you. Any questions?
Thank you for your testimony, and I hope the optometrists in the room don't think that I'm taking away anything away from them, because I can assure you from personal experience, when I had an eye injury, it was a rock that hit me in the eye riding a UTV and was wearing contacts. It started hurting, went to my optometrist, and he treated it for a couple of days in a row and immediately recognized that this was beyond his scope and I needed to be at a ophthalmologist. And unfortunately, it was about 3 days before Christmas. And the one at that time, MD ophthalmologist we had in town, first thing he told me when I went into that exam room that day, and my optometrist immediately got me into his office, and trust me, he was smoked. I mean, that guy worked, 15-hour days. He's like, I'm not sure I can save your eye. But he said, we're going to do everything we can. He literally had me going to his office 10 days straight, Christmas Eve and Christmas. He took time away from his family to examine and treat me on Christmas. Long story short, I fought that for about a year. I was very close to having a corneal transplant because it hit me right in the middle of the cornea. I lived with blurred vision for a year, and ended up having PRK surgery by another MD ophthalmologist in Springfield that removed the scar tissue off my eye. That's been 10 years ago. Haven't had a bit of problems yet or since. But my point is I feel like that chain of, like I like the way the scope is right now. My optometrist recognized this was beyond his scope immediately. Didn't try to, wasn't overzealous or think, this is, still within my ability. And if he had messed around literally another 24 hours, I'd probably lost my eye. Yeah. So, yeah, you're right. When we're talking about our eyes, and I know nothing about this other than the fact when you're threatened to losing your vision, it's a pretty big deal. And but anyway, thank you for your testimony. Are there any questions for this witness? All right. Hearing none, next witness to testify in favor of the bill. Whenever you're ready, please come forward.
Thank you to the chairman and the members of the Senate Emerging Issues and Professional Registration Committee, and to my fellow Missourians at large. My name is Dr. Kate Palos-Anjard, and I'm here today speaking on behalf of the ophthalmology residents of the University of Missouri, Kansas City. I'm in my third of 4 years of intensive surgical residency, and I'm here to speak in opposition of Senate Bill 219. First, do no harm. When doctors graduate medical school, we all take the solemn oath that begins with our first and foremost commitment to our patients, to do them no harm. As physicians and surgeons, we spend years of rigorous training to provide our patients with the best care possible. The path to become a physician, and specifically an ophthalmologist, is long and arduous. We must attend 4 years of college, undergo an intense MCAT exam to get into medical school, 4 years of medical school, followed by 4 years of ophthalmology surgical residency, and then 1 to 2 years of further subspecialization if we so choose. All in all, that's 12 to 14 years after high school, where we spend tens of thousands of hours learning and preparing to how to serve our patients best. The road is long, but worthy to ensure the safety of our patients. I want to be clear that optometrists are a necessary part of our eye care system, but how optometrists are trained is different than ophthalmologists. Optometrists complete 4 years of college, followed by 4 years of optometry school that does not include procedural or surgical training. Their emphasis is in routine eye exams, prescribing glasses and contacts. Ophthalmologists are physicians who went through 4 years of medical school and 4 years of surgical residency in order to diagnose and treat the whole patient. Our expertise lies in our breadth of knowledge about the human body, which is integral in eye care. We train in residency to properly diagnose and treat the whole spectrum of eye conditions, some of which have implications for the rest of the body. What may look like a simple lump to some could actually be a life-threatening cancer. Optometrists who want to remove lumps and bumps do not have the training or medical background to make that distinguishment, nor the skill set to properly perform the procedure. I ask you to reflect that if you would want someone who is not a medical doctor cutting something off your face. This is a harm to Missourians that we should not allow. Because the majority of optometry schools are in states where optometrists are not legally allowed to perform lasers or surgeries, optometrists who encroach on this skill set must learn it at a weekend course. I think anyone would rather have a procedure done on them by a surgeon who trained for 8 years rather than someone who learned it at a course one weekend. Laser procedures on the eye, if done incorrectly, can be catastrophic and permanently blinding. This is a harm to Missourians that we should not allow. Both optometrists and ophthalmologists have for decades collaboratively worked together to take care of patients. Our patients are kept safe when we both use our skill sets as we have trained. Surgery and procedures must stay in the hands of the surgeon. As a physician, I am here today to live out my oath to first do no harm, and I believe that giving this testimony is part of that. Let's take care of Missourians in the best way possible. Let's vote no on Senate Bill 219. Thank you.
Thank you for your testimony. Senator, do you have any questions? No? Seeing none. Next witness testify in opposition whenever you're ready.
Good morning, everyone. Thank you, Senator. Senator. Thank you, Chairman, and thank you, members of the committee, for letting me speak today. My name is Dr. Yuying Dindang, also go by Vivian. I'm also a third year in training with my ophthalmology residency. So today I'm here to talk about my concerns for passing this bill. And first, I'd like to mention, the training that we've had. I don't want to belabor that, but there's been a question about access to care, and it's actually been shown, as you've said, Chairman, that 89% of patients are within 30 minutes of driving to see an ophthalmologist. And if we go to an hour of driving, that's 99.7% of patients are within 1 hour driving of the ophthalmologist. And when it comes to access to care, I think there's also the question of what about in the middle of the night? Ophthalmologists, there's always an ophthalmologist on call at any hour, at any day. And I can attest to that because I spent all of my previous year of training being on call every 4 nights for 16-hour shifts on top of working during the daytime, regular hours 8 to 5. So I have spent most of my year last year frequently going in to see patients with cases to be seen at 10 p.m. at night, 1 in the morning, 5 in the morning, 7 in the morning, anytime, you name it. And if you have a problem also at 3 in the morning, there will also be an ophthalmologist on call to see you at the hospital. The other thing that I'd like to mention is, it's brought up that a lot of optometry students are leaving to Oklahoma to get better scope of practice there. I have a letter from the Oklahoma Ophthalmology Society with an ophthalmologist there who is at the D. McGee Institute, and he lists out in his letter multiple cases of optometrists who practiced, did lasers, and have led to severe complications. One of the cases, the 4th patient in that letter, talks about a YAG that was done for that patient. The optometrist, unfortunately, did not have an adequate view of the membrane that he needed to perform the laser on, and he chose a different lens to get better view. Unfortunately, that lens was the incorrect lens, and he ended up hitting the macula, which is the back part of the eye. And the macula, if we don't know, is composed of nerves and neurons that make up our optic nerve. And so once that nerve is damaged and scarred, there is no reversibility to it. And so that patient suffered permanent blindness due to a wrong choice of lens. And also just last month in March in New Mexico, there's a case that we have in our packet, Miss Vicki Rutledge. She was already, unfortunately, blind in her left eye, could not see from that because she had a retinal detachment, went in to get a YAG capsulotomy, same procedure, and unfortunately, the optometrist also hit her macula, and so now she has lost her only good eye and is permanently blind in both eyes and has no good functional vision. The other thing that I like to bring up is that a YAG is something that has to be waited for if it's a long, wait time, but patients that need a YAG, they're not visually disabled. Usually they get the YAG after their cataract surgery because the membrane forms after the cataract surgery, sometimes due to the inflammation from the surgery. But usually their vision, even with that membrane, is better than before they had their cataract surgery. So it's still very functional for them, and it's not an urgent procedure that needs to be done the very next day. The other thing I'd like to mention is the procedures of removing lumps and bumps. Lumps and bumps are actually something that we are very, very careful about as ophthalmologists because we understand that a lot of skin cancers can show up as a small little bump that many patients actually don't even notice for decades until they come in and be seen by us. And if we look at the packet that we're given, there's a packet that shows you the picture of an example of a lump that you can see. So it's in this sheet here. And if you look at the last case, it talks about, on the left picture, a small pinpoint lump that was actually a melanoma. And when it was actually removed fully, you can see how much of that was actually skin cancer. So lumps and bumps are actually something that usually we don't have just ophthalmologists remove for biopsies, but actually an oculoplastic surgeon. So someone that has gone through the 4 years of undergraduate, 4 years of medical school, 4 years of residency, and also 2 extra years of fellowship to be highly specialized in training and removing this. They also often work in collaboration with dermatologists, a Mohs surgeon who also needed extra fellowship after residency to do this collaborative surgery, as they often, as you can see, After a surgeon in dermatology goes to remove the skin cancer, it's left with a wide, gaping wound that can often go even down to your facial bones. And usually after that's done, an oculoplastic surgeon will come in and do a follow-up surgery to put in a graft from either the abdomen, the arm, behind the ear, to fill up that area and also possibly remove additional structures. So for us, lumps and bumps is not a simple procedure that can be done, lack of better words, willy-nilly. And the other thing I'd like to mention is there's a lot of vague wording in this bill. It's a lot of exclusionary wording, like lasers that can be done except for refractive lasers such as a LASIK or a PRK, but it doesn't mention other refractive surgeries like a SMILE. So does that mean that a SMILE could be within their scope of practice? It also mentions retina lasers that will be excluded, but if we really think about that case where the YAG laser had hit the macula is part of the retina. And so those two patients effectively had retina surgery, retina laser, which is what is supposed to be excluded in this bill. And so I think it is something that we should be very judicious about. And it's something that I personally also have a stake in as someone whose grandfather had went in to do surgery back in some country in Vietnam. And he received surgery from someone who was not properly trained, and he came out blind in both eyes. And so I spent a long part of my childhood growing up watching my grandfather navigate the world being completely blind, and every single day wishing that he had a miracle to make him see again. And so the question of access to care, I really do think goes to also quality of care. If someone were to ask me if I would drive thousands of miles to get my grandfather the care that he had deserved, I would absolutely say yes, and I'm sure my mom would have said yes, and my aunts and uncles as well. And so when it comes to, Chairman, your question of ophthalmology versus optometry, this is the reason why I chose to go into ophthalmology rather than optometry. Thank you.
Thank you for your testimony. And you mentioned PRK, and if anybody thinks that that's routine and like non-invasive, they've never had it, because it's a very scary thing. I've went through it. And shout out to Mercy in Springfield, the MD ophthalmologist did that there. He called me every evening, 5 days post-op. And I mean, that's a scary deal. I mean, you basically can't see anything for 4 or 5 days, you know, just blurred. But it was, long story short, best thing I ever had, but it is not routine. And I kind of lost the train of thought here, but I was going to ask you, so in the optometrist defense, I'm sure there's accidents that ophthalmologists do as well, whether it be malpractice or accidents. I know that happens, but I am curious, and you probably don't have this, but somebody from the association or opposition, I would like to see the statistics in the states that allow optometrists to do the procedures that you all are in opposition to, what those cases and lawsuits of malpractice, the differences between. I'd like to see the difference in the lawsuits of malpractice on these procedures in like Oklahoma, Arkansas versus Missouri. I'd like to see if that incident, the rate of incidence is higher or level or the whatever. So anyway, thank you for your testimony. Do you have any questions, Senator Brown?
Yeah, actually, you kind of stole my thought a little bit. I was interested in the same statistics. I didn't know. I believe it's Oklahoma you were referring to. You mentioned some examples of some bad things have happened, and thank you for sharing your personal story as well. It's
of course
very clear why this issue is close to you. It's always impactful to hear about particular incidents, but I feel that as lawmakers making statewide policy, we have to have the full context, and so having any information about how many of these procedures are taking place in states like Oklahoma, where the scope of practice has been expanded, and being able to really just do a side-by-side comparison, just as Senator Justin Brown said.
Big Brown.
Well, we can talk about that later. But yeah, just being able to see that side by side, to see the practical effects of actual results. I mean, some of the points I completely understand are being made, and, you know, the bumps on the eyes and things like that. One concern would be, you know, if someone lived in an area and provided maps that show that, you know, most people are within a reasonable, I don't know that you provide the map, somebody provided with a map that shows where these are located, and you know, a lot of them are within reasonable distance. Others, you know, if people have trouble getting around, it might be more difficult to get in versus an optometrist. And so I'm kind of weighing that, like, would it be better to get into somebody versus nobody? And, you know, maybe would there be a case where optometrists might identify something, raise a red flag, and then recommend that they see somebody that has more experience in that field that then might be able to take on something like that. So just all things kind of I'm considering as I hear this testimony, and just once again I want to thank you for coming in and sharing your story.
Of course. Thank you.
Thank you. Next witness testifying in opposition to, whenever you're ready. How many other witnesses do we have to testify? Please raise your hands. A couple, 3, 4. Okay, thank you.
Mr. Chairman, members of the committee, I'll be brief. Jacob Scott here with the Missouri State Orthopedic Association as well as the Missouri Gastroenterology Society, on record in opposition to today's bill. We've heard some testimony from actual providers who are more equipped to talk about the medical concerns associated with it, but I just wanted to reiterate that the legislation before us is what you have to consider, and I think that the bill certainly has some concerns that the committee, I hope, will share. The exclusionary nature of how the language is written, usually legislation, you have enumerated provisions that will say what they want to do. That's not the case with this legislation. Senator Brown, to your point about how other states are doing with the scope of practice, it'd be interesting to know how those are reported. You know, is it reported to the Board of Optometry? Is it reported to the Health Department? So there's ways and opportunities within the legislation to, you know, provide more accurate information for healthcare decisions. But yeah, there's a plethora of reasons why we think the expansion is unnecessary. But you know, also just the way the legislation is written is also very much of concern. So happy to answer any questions.
What are the two groups that you're representing?
The Gastroenterology Society and the Missouri State Orthopedic Association. So we got your orthopedic surgeons and gastros.
Do either of those professions perform any of these kind of procedures?
No, not ophthalmology surgery, but we're very, very much concerned about surgical procedures being done by those that aren't trained in surgical procedures.
Okay, so this doesn't have any direct impact on your particular clients?
Not directly, because they are not performing ophthalmological surgery, but it is of concern when there are other professions that are seeking to perform surgery when they're not adequately educated or trained to do so.
Okay, so this is more about concern about a precedent being established that could spill into other areas of groups that you might represent.
Sure. Yeah.
Okay. All right. Thank you.
Thank you for your testimony. Any other witnesses testifying in opposition to, whenever you're ready.
Mr. Chair, members of the committee, Scott Pentman with MOSEPS, the Missouri Society of Eye Physicians and Surgeons. I'm in a bit of a pickle. My next meeting is at 11:30 with the Vice Chair of the Appropriations Committee, so this may not go so well for me. I was kind of hoping we'd run out of time and I'd get out of this little pickle, but I did want to mention in couple of specific questions to respond to. There's a packet of handouts the committee was provided today, and there is a comparison of outcomes for LTPs by optometrists versus ophthalmologists in Oklahoma. And I think the summary is you're about 3 times more likely to have additional procedures if that initial procedure is provided by or conducted by an optometrist. So I leave you that JAMA study, including some additional information. The only other couple of things I think Mr. Scott pointed out as well is that the way that the bill is currently drafted, it does kind of take into consideration that healthcare is dynamic and that there are changes to it. But essentially, the State Optometric Board would have to exclude any future procedure or surgery from their current scope of practice for it to not be allowed. So by nature, that means any new procedure that comes up that their board doesn't take action on, they then would be allowed to conduct, which to us is pretty far-reaching and probably beyond where we want to be. My guess is beyond what the sponsor is looking to do. And the only other thing I'd like to kind of point out is that, you know, we are talking about the use of lasers, and I think we could all agree, like, we don't want Scott Penman running a laser. I'd probably hit your forehead instead of the actual eyeball. So it is not just a little bit of training, and it's not just a minor procedure. We're talking about a laser that enters into your eye, the actual orbit, and destroys parts of tissue, and that is by nature, by definition, surgery. So just kind of pointing those things out. We're happy to always visit with the sponsor. We have been visiting with the optometrist and provided some examples of how we think we might be able to address some of the access issues that are being raised and some of the concerns. I think that the origin of this bill is that we need better access to more care. We just continue to try and figure out how that balance to make sure it's quality care provided by the right and proper trained providers. Happy to spend another 45 minutes answering questions.
Thank you for your testimony. Do you have any questions? Seeing none. Next witness testify in opposition. Whenever you're ready.
Thank you, Mr. Chairman, members of the committee. David Jackson, registered lobbyist on behalf of the Missouri Society of Anesthesiologists, as well as Jefferson City Medical Group, and kind of for two different purposes, both in opposition to the bill. But I want to touch on Senator Brown's question to one of the previous witnesses regarding whether or not this affects them or not, or setting a precedent. The anesthesiologists on this are affected in the sense that they provide anesthesia for ophthalmology cases. But we also feel like it's important sometimes to get the perspective of a physician or a stakeholder who's not directly affected by this, who doesn't have skin in the game necessarily. Because, if you're looking at two competing companies for something or two competing, proposals, of course the marketing material is going to say they can both do it, and you're, stuck here to figure out which one's right, which one's wrong. And in, non-medical situations, what you're probably going to do is go talk to people that you know and trust who've tried both, and get their opinion, see what they think. I think that's an appropriate mechanism to use in situations like this, is don't take our word for it in this room. Go back and talk to the people in your district or people in your family and ask them, what they think. I think if you're hearing from doctors in your district that is inconsistent with what you're hearing here, I think it's pretty hard for us to make a strong case in opposition. But, I can tell you that anesthesiologists, when they look at the procedures in this bill, none of which I can pronounce or understand, they, just don't feel like it's safe. And so that's the purpose for them relaying that concern. Jefferson City Medical Group used to have an ophthalmologist. It's pretty hard to recruit doctors, the rural areas or areas, even Jeff City. They would, if this made sense for them, they would hire an optometrist, but they just feel like it's not the right call for patient safety. I actually applaud in the supporting testimony, while my clients, I think, disagree, where they view on the bill, I applaud the testimony from the patient. We don't hear enough of that. Normally it's just providers on one side against providers on the other side, rinse, repeat, same issue 20 times a year in this committee. And I think it's important to hear about what patients really want, regardless, position on it. The last thing I'll mention is in terms of other states, we always hear, well, this is happening in this state and nothing bad has happened. And I appreciate, I think both senators asking about the malpractice data, because, we never really review that. That's pretty important. I would also suggest that it doesn't always tell us everything. There's a lot of times that somebody gets hurt, gets sick, whether it be optometry or nursing or regardless, something's missed. Maybe they didn't get hurt, it just got missed and misdiagnosed. But they may not file a malpractice case. They may not go hold a news press conference about it, but it doesn't mean that it's working in those other states. And so there's just so much out there beyond what we could possibly digest in these committees through testimony that this is a pretty big decision. And people asking you to essentially open up businesses to do surgery. And so I would just recommend the committee look at a lot more than we could possibly put out today in testimony. But happy to answer any questions.
Thank you. And one of the points you just brought up, David, that we miss a lot, and I will tell you, is regarding the recruitment of doctors to rural counties to solve this issue. I have a son that's a third-year veterinary student, and I can tell you right now, veterinary medicine does a way lot better job of incentive programs there's an extreme shortage of large animal practitioners in this state. And the veterinary school does a lot better job of incentivizing students to go to rural areas. We have upped that appropriation every year since I've been here in 2019, and I've not yet to hear from the human side one time and there is a program for that, but it's very small. What it boils down to, for easy math, 4 years of veterinary school is right at $400,000. It's pretty much the same cost as medical school. It's about $20,000 cheaper. But at the end of the day, if they commit to a rural community or a large animal deprived area for 5 years, they essentially get almost 1 year of their school paid for. So I wish that instead of sometimes using the excuse that we don't have access to these certain types of healthcare, whether it's this or nurses or whatever, that we would look into maybe incentivizing these young docs coming out of medical school, whether it's this certification or what it is, to do that before we start messing with the scope of their licensing. But thank you for your testimony.
Yeah.
Do you have any questions? Senator Brown.
I want to say I appreciate your comments about choice. I think that's an important thing. If this bill were to pass, wouldn't they still have choice where they could weigh a variety of factors such as who they have access to within a reasonable distance, along with any data available to them about potential outcomes, qualifications, things like that, and then use that information to base the decision on who they go see or who they're able to go see?
You're right. Yeah, I think personally, I think that this issue, when you're dealing with scope of practice, differs from other products or widgets or services. Is that I think when you're making a healthcare decision, whether it be an emergency or not, there's kind of an inherent trust from patients that somebody checked out to make sure that whoever they're going to is qualified to do what they do, and that you don't really grill someone's resume when you're in the operating room of where they went to school, what courses they took, what they did, and some of it can be pretty confusing. I mean, look, I've been lobbying for doctors for 18 years, and last week I got accidentally mixed up optometrist and ophthalmologist, and that's, it's for the, and that's nothing against patients or, saying that, they're not smart enough to figure that out. It's confusing. There's a lot of terms. A lot of people call themselves doctor. What's a medical doctor, a DO, an OD, MD? And so I think whenever you're in those situations, you just expect that, somebody made sure they were qualified, and that somebody is these committees. And so, I just think it's a little bit different. We have to treat it a little more delicately than we do other issues.
And you represent the anesthesiologists.
Yes, sir.
It's kind of a similar question. As part of I asked one of the previous witnesses, part of your concern, other similar scope of practice bills that have been filed that would expand certain practices?
I'm sorry. What's your question specifically? I'm sorry.
So is part of your concern the reason that you're here testifying in opposition, in part because of a potential precedent for expanding scope of practices to other professions? For instance, just say, CRNAs, I'll throw that out there.
I'm familiar with that bill, Senator. Look, we are certainly opposed to that legislation. However, I wouldn't suggest that we're here today because of a precedent. It's more because it's interesting. You hear attacks on, sometimes people say, well, why are you testifying for this? This doesn't even affect you. But then other times you get criticized and people saying, well, this is a turf battle. You just don't want people taking your business. Well, we believe that there's a unique perspective from a doctor who may not be directly affected by this just because of their medical knowledge. I mean, my brother's an OBGYN, and I ask him medical questions all the time that aren't OB related just because I want his opinion. I assume you can probably relate to that. I did forget to mention that there's one kind of technical provision in this on page 4, line 83. It talks about prohibiting the administration of anesthesia, and we mentioned this in the House too, and I can talk to the sponsor, but and I'm sure there's intention there. We're just unsure if that's prohibition of doing procedures under general anesthesia or their ability to administer general anesthesia. But I think that's more of a technical issue. But yeah, to answer your question, it's not so much we're testifying to set a precedent as much as just trying to provide a perspective from the medical background.
Gotcha. Well, thank you for taking my questions. I couldn't help myself.
I don't blame you. I would have done the same thing.
Been a minute since we've been able to have a nice, fruitful debate. So
you bet. Thank you, Senator.
Thank you for your testimony. Are there any other witnesses testifying in opposition? I remind you that we have another bill, so please don't repeat the testimony we've been hearing for.
Thank you, Mr. Chairman, member of the committee. My name is Rachel Bauer, here in opposition to Senate Bill 219 on behalf of the Missouri State Medical Association and the Missouri Association of Osteopathic Physicians and Surgeons. We believe in physician-led, team-based care where people are doing what they are educated and trained to do, what is best for patient safety, and allowing non-physicians to do surgery doesn't fall under that scope for us. So, thank you.
Great job, and thank you for keeping that brief. Are there any other witnesses testifying in opposition? Whenever you're ready, Garrett.
Garrett Webb, registered lobbyist for the Missouri chapter of the American Academy of Pediatrics. Our opposition to the bill stems mainly from a lack of protections around the age that these procedures could be performed on the patient. We take a very strong position on ensuring that age-appropriate treatment is conducted by a physician with a certification and a specialty to treat that. So that is our reason for opposition.
Thank you for your testimony. Are there any questions for the witness? Hearing none. Are there any other witnesses testifying in opposition to you? All right. Senator, do you have any closing remarks?
I do know your time, and I know it's short, so I'll be really quick and just do things that'll probably get me in trouble, Senator. Not from you, but people on the left are scared of what I might say now. People on the right are scared of what I might say now. Let's first talk about scope of practice really quick. I have a son that has a community college education, and he's helped perform surgeries because the person couldn't get to where they needed to get without him helping drill a hole in their head, etc. Did that. The nurses in my family couldn't believe that went on, but he did that. I have doctors of pharmacy in the family, and I have a nephew. I think Uncle Senator will be dead before he ever gets out of school. He's going to use the little cameras inside of you and do all this kind of crap. I don't think he can't fish very good, but by God, he's going to be able to run that stuff, okay? Is what I think. The next part, scope of practice for you and I, will have to do this in the office. My guess is your dad and your son probably thinks that the ag teacher shouldn't do quite as much as what he did at Chillicothe, and we'll have that discussion. Yes, I made one mistake one day. I was in a hurry and used a scalpel instead of a needle, and your father would have yelled at me watching me do it because I knew better than to do that, and I ended up with a problem I had to get fixed. We can't be scared of all these things or we wouldn't drive a car, right? And the last thing on it, my guess at the end of the day of this, and it probably makes both sides back there irk, more than likely nobody's going to get a boat repossessed no matter what happens with this. Thank you. I took stat too that you took as well, and we know how those numbers are from taking stat.
My father was still here, God rest his soul, you would not want him to respond to that. All right, we got one. We got one more bill left, Senate Bill 481. Senator Bernskatter, whenever you're ready. I'm sure this is totally non-controversial. We'll just buzz right through it.
It's kind of like when I do pest control, everybody leaves.
Well, let's expand the scope of that, too.
Yeah.
You know, why not?
I'm used to everybody leaving. Thank you, Mr. Chairman, and Hannah and Ashley for being here for this committee today. It was kind of like airing of grievances in that last hearing, wasn't it? So this bill is the Missouri Uniform Homeowners Association Act. In 1983, Missouri passed Uniform Condominium Act, but has not passed similar legislation for HOAs. This bill provides a basic guideline for HOAs to follow to provide uniformity across the state and address common issues. Most HOAs declarations start off as a very basic, bare bones document that sometimes tie the hands of future HOA boards. Some problems include vacancies on the HOA board that they cannot fill, unattainable voter thresholds to amend their declarations, or unclear procedures on how to amend this declaration, and financial problems due to the rising costs to maintain their communities and the inability to increase assessments. This bill seeks to help HOAs address these problems. I have some Community Association Institute members here that will be able to answer any questions. Thank you, Mr. Chairman.
Thank you, Senator. First witness to testify in favor of the bill whenever you're ready. How many witnesses do we have to testify in favor of? How many in opposition? Okay, we'll go ahead and do the in favor of the bill first.
And I'm going back to the utilities, if that's okay with you, Mr. Chairman.
You're fine. Go ahead. I'll take any questions and yield those for you. There's a lot more faith in me than myself.
Thank you, Mr. Chairman. My name is Todd Billy, and I'm here on behalf of Community Associations Institute. This is the only area of law I've ever practiced. The underlying problem is quite simple. In 1970, there were hardly any HOAs in the nation. About 2 million people lived in them. Now we're over 75 million. There's 6 million. 1/6 of all Missourians live in some type of condo HOA type situation. And the notion that the original declaration was perfect is silly. So what ends up happening is these associations get stuck. They can't operate right. So what ends up happening? They end up having to spend money on lawyers and things that it should be fixed. We've learned lessons. So over the years, this bill has been proposed. The developers, lenders, construction lenders, realtors, HBA have all said we don't want this to apply to us. So if you read the bill, you'll see that we have used a thesaurus to describe all the ways that we have no intention of messing around with the rights of the declarant or the developer. No alternative language has been proposed for it. We have no interest in touching or messing around with the developer's rights, whatever they are, whatever they want to do. What ends up happening is after the fact, years later, we have issues. One of them is quorum. There's a lack of quorum. A board stops trying. The election is bad. And then guess what happens when someone doesn't pay? They say, well, guess what, Your Honor? The election was bad. Quorum was bad. Everything they did was bad. And then everyone usually does that doesn't happen. Sure it did. It happened to Ad Diem, a Lincoln County HOA. They had to somehow try to figure out how to unwind 40 years of transactions. Because of Missouri case law, we also have something called an assignment. If an association, especially in the St. Louis area, a lot of HOAs were not incorporated. Insurance companies are forcing them to be incorporated, so are banks. Banks don't want non-organized entities. Well, now they have to pay a lawyer to figure out how to do that because Missouri case law requires it. This bill just says they can do it. Solves the problem without a lawyer. They have to pay the $25 Secretary of State fee, no lawyer involved. Owner protections. There are none. So how do we do that? We enforce them because they're going to be incorporated. Now it is undoubtedly known how an owner can get access to records for their HOA. Another prime example is collections. It's a comment. It comes up every year. Somehow I'm a greedy lawyer, even though we're solving these issues. No one wants to go to court on debt collection. It's a myth. So how do we fix the issue? We go to small claims. We open it up so board members themselves can go and get small claims judgments and they can collect on it. No lawyer has to be involved at all. So all of these things are designed to fix all of the internal issues that we have. If I live in one HOA, let's say it was built by an HBA member and I go across the street and I wasn't, there's some things should be pretty darn standard. And a lot of those are owner protections and rights, and that's how we do that. So I thank you for your time.
Thank you for your testimony. Seeing there's no questions,
I know.
I will have the next witness to testify in favor of whenever you're ready.
Thank you.
Good morning. My name is Della Miller, and I'm a co-owner of Missouri Association Management at Lake of the Ozarks, where I've managed HOAs for 31 years. I strongly support Senate Bill 481, the Missouri Homeowners Association Act, because it provides much-needed improvements in the overall effectiveness of HOAs across Missouri. The key benefits of Senate Bill 481 establishes uniform guidelines for HOAs, which will reduce confusion and prevent disputes. Improved decision-making helps overcome challenges caused by homeowner apathy, and it lowers the voting thresholds, which can often stall necessary amendments and budget approvals. Financial sustainability addresses funding constraints and ensures HOAs can maintain essential resources and services. Preserving declarant rights. This safeguards the rights of the developers and helps maintain the initial vision of the association, which benefits the HOA and residents. Dispute resolution framework, that's something that I found is really important. It introduces a mediation process before legal action. So owners can work these situations out with the association prior to costly and time-consuming litigation. I really feel this legislation is a crucial step towards strengthening HOAs and protecting homeowners across Missouri. I urge you to support Senate Bill 481 for the long-term benefits of our communities. Thank you for your time. If you have any
Thank you for your testimony. Are there any other witnesses testifying in favor of the bill whenever you're ready? Come forward.
Good morning, Mr. Chairman. It is still morning. Yes, for 30 more minutes. Okay. My name is Jessica Goodman, and I reside in Wright City. I work across Warren, Lincoln, St. Charles, and St. Louis counties as a professional community association manager. I appreciate the opportunity to speak today and express my strong support for Senate Bill 481, the Missouri Homeowners Association Act. This bill introduces several key provisions, including those addressing amendments, quorums, budgeting, and the collections of delinquent assessments. These provisions are critical in helping the boards of planned communities move forward with the essential business that their communities expect of them. One of the biggest challenges in our industry is apathy. Homeowners are busy and have limited time and attention to dedicate to association matters. More often than not, important issues are delayed because homeowners assume that someone else will take care of them. Due to this apathy, processes such as amendments can become unnecessarily burdensome, consuming time, resources, and energy that could be better spent on community improvement projects. Annual meetings are often plagued by low attendance, forcing boards to hold multiple meetings just to finalize elections. This waste of time and resources is something that could be avoided if more reasonable processes were in place. Additionally, governing documents that set a maximum amount often fail to account for inflation and rising costs. Many communities that have 20 or more years old are now finding themselves unable to raise assessments to cover necessary maintenance and services without going through a costly and time-consuming amendment process. Delinquent accounts are another significant burden on communities. Not only does the community lose the funds needed to maintain the property, but they also incur upfront costs to send delinquent accounts to collections or attorneys with the hope that they will eventually be reimbursed. Many of the boards I work with are comprised of volunteers who care deeply about enhancing, preserving, and protecting their communities. However, they are often discouraged when they face obstacles that prevent them from moving forward. Senate Bill 481, the Missouri Homeowners Association Act, includes provisions that would significantly ease many of these burdens and help these dedicated volunteers continue their important work. For these reasons, I urge you to support Senate Bill 481 with a recommendation to pass. Thank you for your time and consideration today. I would be happy to answer any questions.
Thank you for your testimony. Any other witnesses testify in favor of the bill? Whenever you're ready, please come forward. First witness to testify in opposition to, whenever you're ready.
Good afternoon, Mr. Chairman and members of the committee. My name is Jackie Barget. I'm a registered lobbyist here on behalf of the St. Louis Home Builders Association. I know Senator Bernskoetter isn't here, but I did want to thank him. He did take the time to meet with us back in December to hear our concerns, so I just wanted to say thank you to him for that. Our association has opposed various versions of this legislation as it's been filed over the past 30 years. No version of this legislation during that time has ever made its way out of a House or Senate committee, and I quite frankly think that's because the bill has been authored, as was mentioned before, by HOA attorneys to increase their revenues on expenses and fees associated with the creation and management of HOAs. We've continued to ask over the past several years, what is the issue that we're trying to fix here? The only answer that we have ever gotten from the proponents is that their attorneys know our attorneys and they'll get together and they'll work this out. In my 13 years of lobbying, I'm sure the folks that get up after me that have been lobbying for quite a lot longer would agree that that has never happened. No attorney from the proponent side has ever reached out to a St. Louis Home Builder Association member or our attorneys. And I just in general, I know folks in general have issues with their HOAs. They want to paint their fence a different color. They want to be able to put a pool in. They want to be able to park a truck out front, and nothing in this bill will actually address that. In light of time, I will not go through all of our concerns with the bill, but I do want to point out a few of them that you'll probably find of interest. First of all, I know it was mentioned before, but nothing in this bill relieves declarants, developers, or home builders of complying with the provisions of this bill. We still have to follow the bill. We still don't have a right in changes that are made to that declarant throughout the process, which is why we are very, very adamantly opposed to this. One section of the bill also mandates that every HOA must be organized under Chapter 355, therefore must obtain an EIN number and comply with all Missouri corporate law. What that means is a small rural community of 5 homes has to hire an attorney to create an HOA, expenses there. If Senator Brown's family wants to end up building a few homes on the family farm to keep everyone close, what's the maximum number of homes that you have to have there before you have to hire an attorney to create an HOA and comply with Missouri corporate law as well? One section of the bill also mandates that any caps on assessments and rates are automatically void if this bill were to pass, which means increased fees and rates for homeowners without a vote of the owners. Also increased fees for attorneys. I think we all would agree that no increase should be made without the owners or homeowners voice in that. One section of the bill also allows amendments to be made to the declaration without a vote of the owners. Again, I think homeowners have to have a voice in any change that is made to the regulations on their properties. And finally, I would just say if you take a look through the bill and just note the amount of times that the words attorney fees are noted in there or the increased ability for cause of actions, it is very apparent that the bill does not benefit homeowners in that way. We have proposed some alternative legislation in the past that has not been accepted as well. But with that, I will take any questions.
All right. Thank you for your testimony. I don't have any questions. Next witness testifying in opposition, whenever you're ready.
There's a leg right there. Good morning, Mr. Chairman and members of the committee. My name is Andy Arnold. I'm a registered lobbyist here on behalf of the Missouri Land Title Association. We're the folks that close property transactions and underwrite the properties so that the banks and everybody can sell the paper. I'm not going to belabor the point. There's 2 areas in here that we've looked at that just kind of are glaring at us, and it has to do with lapsed HOAs. I live in a subdivision where I guarantee we haven't got a corporate charter on our HOA. And if I got to go get a corporate charter on my HOA, the question our real estate attorneys and our underwriting attorneys with the companies have asked is that means all these dormant HOAs now have to be active. and we've got title commitments on all these properties or a lot of these properties. That creates an issue for potential lawsuits and problems there. The second part is there's a provision in here that talks about subdividing property in your plat. So I go in and I buy a 40-acre plot in a development, and I decide I want to subdivide off everything but 5 acres for agricultural use, because I can get a break on my taxes if I can declare it as agricultural. That has to be approved by the HOA under the way this is drafted. If I do that anyway on my own, and then I go out and try to get a title commitment, the title insurance companies aren't going to be able to write a title insurance policy on that piece of property without approval from that HOA. We think it just adds another step in the process for title commitments and the agents, and anything that delays a title closing or anything like that costs money. And it costs us money, and it costs the homeowner money and the person trying to buy or sell a property. So that's why we oppose the bill.
So if these HOAs are not properly incorporated, is the title insurance worth the paper it's written on then?
Good question. No,
Yeah.
if they're not properly incorporated, it'll be noted in the title insurance commitment that there is they call it a carve out for the fact that if there's any.
So it's probably noted in the title insurance policy that there is an HOA, but it's really not.
Right.
Okay.
There'll be a box they have to check that says the HOA is not active or isn't working.
So I would assume that that's why the bankers are here, because this could be a real issue for title insurance policies. Okay.
We kind of all hang together on that one, or we hang separately. That's the kind of way it works.
All right. Thank you for your testimony.
Thank you, sir.
Any other witnesses testify in opposition to?
Right on cue, Mr. Chairman. David Kent, registered lobbyist with the Missouri Bankers Association. Just want to echo the previous testimony. And of course, if we have concerns or problems getting title insurance, that really has a huge impact on our ability to finance or lend within an HOA. So for those reasons, we're opposed to the bill.
So from my previous banking career of 15 years, there was very few times we ever made a claim on a title insurance policy. I mean, it was pretty rare where I come from, and when we did, it never worked out. So, but is this an issue that Missouri bankers are seeing, or what? I mean, how do they get by with if there is a claim made and they're not incorporated, correctly? Are they not? Is that a way for the underwriter to be able to get out of having to be responsible for the insurance policy?
Keith, do you know the answer to that? You want to testify? Just so that your question is correctly answered.
Well, I mean, I'm assuming that it is. It's just one of those deals like, well, you shouldn't have, bought the property. It says right here in the title insurance policy this HOA is not correct. And what I'm getting at is, what if they run off with all the money that's in the HOA? I'm involved in 2 HOAs, and one of them, I'll just stop right there. But, and one of them's at the lake, but.
My name is Keith Thornburg. I'm the General Counsel for the Missouri Bankers Association, also a registered lobbyist. I'll complete a form. Most of the issues we see in the banking area with HOAs has to do with the assessments, and sometimes they get ahead of a bank's lien on the property, and there's different circumstances that happens, and it's always controversial. But as far as owner disputes with their HOA, or issues like that, typically banks aren't going to be involved in those. But if you do mandate that the HOA be active, and they don't have to be incorporated, they can just be an unincorporated association. But if you mandate they have to be incorporated, they'll have to be incorporated. And so a lot of these inactive HOAs or unincorporated HOAs will incur expenses to abide by the formalities that this bill would require. Something else I found interesting in the bill, and this is aside from the lender interests and title insurance, but it exempts the common property owned by the HOA from taxes, as well as their personal property and equipment. That violates the Constitution. So, I mean, it's just a curiosity that it's in there.
So you're talking like docks and lifts and things like that?
Could be the lake, could be the clubhouse, restaurant in the clubhouse.
Pools.
It could be
Swimming
power
pools.
equipment. Yeah. I don't understand the basis for exempting it from taxes. I know it's an expense to the owners, but everybody pays taxes. But under the Constitution, to exempt real property has to meet certain requirements for educational, charitable, religious use. And to exempt personal property, usually it's called out in the Constitution. The legislature could reduce the assessment ratios, but you can't totally exempt it. But that's just curiosity I found interesting in the bill.
Thank you.
Good morning, Mr. Chairman. Heath Clarkston here on behalf of the Mortgage Bankers Association of Missouri. Similar concerns as Mr. Arnold expressed, and I would add that there is provisions on finding a quorum and not getting a quorum, and then you have another round of not getting a quorum, and finally they just continue on. All that leads to potential expenses that if somebody's not making their mortgage and it goes to foreclosure, it's another issue that the lender's got to deal with. So.
Well, and what I have found in one of the HOAs that I'm involved in, it's like cyclical where it's cliquey. And then once that group pisses off everybody else, then it just becomes another group. And it's a huge concern for me. Andy, when we get back upstairs, I got some questions for you on that. But thank you for your testimony. Any other witnesses to testify in opposition to?
Mr. Chairman, Andrew Arnold on behalf of the Missouri Independent Bankers Association, and I would just echo the concerns of my colleagues in the banking industry.
Thank you for your brief testimony. Are there any other witnesses testifying in opposition to?
Mr. Chairman, Ashley, Jason Zamkis, registered lobbyist here on behalf of the Missouri Association of Realtors. We work closely with our industry partners that have testified in opposition prior to myself, and if they've got problems, we've got problems, and for that reason, we'd like to go on record in opposition.
Thank you for your testimony. Are there any other witnesses testifying in opposition to?
Good morning, Katie Gamble here on behalf of the American Resort Development Association, which are the timeshares. Want to go on record in opposition with a lot of the concerns previously addressed, but also there's a portion of the bill that talks about what is a planned community, and it says that timeshares are not a planned community, except that they may be a planned community, which is a little confusing. So if the intent is to exempt timeshares, we'd prefer to just say that they are not part of a planned community.
Thank you for your testimony. Are there any other witnesses testifying in opposition to? All right, since we don't like to do for informational purposes here, which is typically in opposition, with no other business to come before this meeting, we are adjourned.